crisis hotline get to know folks in the community, either because they work directly with them or they have to look for resources, and they get to know the partners, and the partners get to know them. So I think that that's one of the benefits of Austin Travis County Integral Care in general, but for sure in crisis hotline, is that our employees tend to stay with us, and that is something that you can't buy, because you end up creating relationships in the community. So folks, there's kind of an inherent trust in what's being said, and also if they're looking for resources. So I always find that that has, been a big benefit for our agency, but the community as a whole, because they can get information that they trust.
APD, the Austin Police Department, and ATCIC have made great strides over the last year and a half in increasing our collaboration. It was good before, but I think we have attained a greater level of service, and therefore better results, not only for the clients, but better trained staff on both sides. The police officers are better trained because we're more inclusive in our training, and I think ATCIC staff has received the benefit of understanding the police perspective much more. The hotline is our gateway to the mobile crisis outreach team, which is utilized on a very frequent basis, not only by the officers in the field, but also specifically by the crisis intervention team. There's a lot of interaction that goes on. The officers will often use the mobile crisis outreach team for staffing of cases, for co-responding to certain incidents, and that goes both ways. MCOT often calls us and called our office to say, hey, we're just not sure about this client, about the safety, etc. Let's talk about it and see what maybe the best approach would be. It all boils down to the collaborative nature is seeking the best results for the client, for the individual, and getting them the appropriate level of services.
In fiscal year 2012, we served we had over 8,000 callers that contacted the crisis hotline. So those are individuals that are calling that are in crisis, also referrals from the local emergency departments, police, family and friends calling. The hotline, the phone number is 472-HELP, and it is a single point of entry line that is operated by Austin Travis County Integral Care. And it serves multiple functions. When a caller contacts us at the line, they can find out more information on intake services, as well as potentially scheduling an intake. They can find out directions to our multiple facilities, as well as additional community resources. The main function of the hotline itself is to serve the crisis services piece. So it's 472-HELP. Anyone in the Austin Travis County can contact it if they feel like they're in some sort of crisis, and they can speak to a mental health professional 24 hours a day, 7 days a week.
A few years back, Integral Care actually set up an email address on our website, which is crisisinfo@atcic.org, where people in the community who may not want to call us can send us an email, and those are forwarded directly to our crisis hotline staff to respond to. And we also are part of the Lifeline Crisis Chat Network, and we take chats through that. We've been taking chats since December 2010, and that service of ours is accredited by Contact USA.
Chats generally last longer than crisis calls. Sometimes we can be interacting with a visitor on crisis chat for 2 hours. Sometimes longer, depending on the need. We most often see eating disorders, relationship problems, self-injurious behavior, and suicidal ideation. I believe that we can reach a different demographic, maybe those who are uncomfortable calling crisis hotline, say like a younger demographic. We see a lot of those visitors, younger. And I think that they feel more comfortable, maybe expressing how they're feeling or addressing any concerns that they may have on a chat.
Anybody who's in crisis, they call here, and we have counselors standing by line 24 hours 7. and they talk to a patient, they provide referrals and they provide resources. And in case of emergency, in case of crisis, in which we either dispatch the police, 911, or we have our mobile outreach team. They go out and assess the person, and depending upon his specific needs, we provide treatment. Another excellent system I use is callback system. If somebody who I see here and assess them here and get them started on medicine and they have a family, we call back to the family and call to see how they are doing, whether they have responded to medicine, whether they were able to afford medicine, get started, whether the patient was cooperative with the treatment plan we prescribed here. In that case, we monitor them for 1 month and provide them resources in the community.
Just recently dealt with somebody out of San Antonio. They were here in Austin. He was providing us no information. He was suffering from bipolar, and he was been off his meds for almost a year. And he was very paranoid and did not want to give us any information. We had limited information through the family, but through the hotline, we were able to get in touch. We were able to gather information that was statewide. And without them, we wouldn't have been able to get it. And then we ended up hospitaling the guy, and he's still in the hospital today.
One of my personal examples was at one of our middle schools, and the counselors were off campus. They were at a training, and so the principal called me and said, I have a kid that's making a suicide outcry and I have no idea what to do. So I said, go ahead and make the call to the psychiatric emergency hotline number. And they had made the decision to activate mobile crisis outreach team to come to the campus. So we did get both parents were at the campus. And I tell you, it was so impressive how the MCOT team worked with these two parents. They worked with each parent individually in small rooms, then pulled the two parents together to put a goal, a plan in place for the student. So that was really tremendous.
We have been around for approximately 12 years. The crisis hotline, or the hotline itself, has been around for a very long time, so we've always kept data on people who are interested in knowing a little bit more just about the hotline in itself. But also we definitely refer people to the hotline because it is a little bit, it's open more than we are, of course. It's a 24-hour hotline. Our office is closed at 4, and when we're not able to handle a particular crisis that is coming from a peer perspective, we rely on that hotline to be able to provide a little bit more of a professional outtake on it.
Here in Austin, ATCIC and the hotline provide such an invaluable resource to our citizens. It's not just about people who are specifically clients or people who are in a crisis situation. It's also a great tool for people and family and friends who are just not sure where to go. They know they need something, but they may not be suicidal. And I know we're kind of focusing on the key of suicide, but I think we all want to prevent people from ever cycling in a crisis in the first place. And that's where I think the hotline can be such a great tool, because it can help get that individual before they're truly in a crisis state, make sure that we get them in that safety net of services and help intervene before it becomes a possible tragic outcome.